Hello, welcome everyone. Thank you for taking your time on to this Tuesday to join us. This is Tri-City's webinar series that we do every Tuesday at 11 a.m. Today's topic that we will be discussing is COVID-19, considerations for the workplace setting. And this presentation will look at how do we look and use a trauma-informed approach when supporting ourselves, colleagues, coworkers, staff volunteers who are currently in the workplace or maybe going back into the workplace, who are maybe still telecommuting, working from home. So those are considerations we'll be discussing, but from the lens of a trauma-informed care approach. My name is Lisa Naranjo, and I'm a program supervisor at Tri-City, and I will be leading our discussion today. And so thank you again for joining us, and we'll go ahead and get started. Also, I just want to quick introduce, I have Chris Anzalone and Daisy Martinez. They're on the back end with me, and they will be helping me through the webinar today. So thank you for that. So we're going to get started. So just a few things to keep in mind. If this is your first time joining our webinar, these are just some housekeeping tips that we would like to discuss right up front. If you've been to our webinars before, this is familiar language for you. But just so you're aware that all attendees, your camera and audio will be off. You'll be on mute, and you will not be, your face or none of your information will be disclosed or shared during this webinar. And the reason that is because this webinar is being recorded. We like to record these webinars and post them on our webpage for our community members, participants, to view them at a later date. If they missed it or the information was so fantastic they want to see it again, they can view it on our webpage, which usually is on our website within the next 24 to 48 hours once the recording's done. If you do have questions, I highly encourage you to ask questions. This is why we're here, to support you and pick your brain as well as you pick ours. So on the very bottom of your screen, there should be a box that says Q&A. Please click on that and type in your questions. Daisy and or Chris will be the ones who will be responding to those questions directly, or they will be letting me know of a question that we should address to the whole group. We will do that throughout the webinar. By the end of the webinar, if your question has not been addressed, please retype it in the Q&A so we can address it before we end our webinar. And just as a disclaimer for folks who are in some amount of distress or concerns for themselves or someone they know and are really looking for immediate support or services that they themselves or someone they know can benefit from, we highly encourage you to call Tri-City at 866-623-9500. This is our toll-free number that connects us to our main clinic, and they can direct you to a staff or department or program that would best fit your needs. And then, as of course, if there is an extreme emergency, please call 911 if necessary. At the very end of this webinar, you will see a new page pop up, and this is for our survey. I highly encourage you to take a moment to complete the survey. This gives us some really good feedback on how we're doing. The information we're providing is useful and helpful. And ultimately, if there's other things that you would like to see Tri-City provide during their webinars, you can provide some feedback. So please don't forget, once the webinar is done, to take a look at that. And then last, again, just thank you for coming and participating and taking time out of your day to join us. Just to get an idea of who is with us today, I'm going to just do one quick polling question just to get a feel of our audience. So you're going to see a polling question. There's two questions I'm going to ask you to complete. The first one is asking if you are viewing this with anyone else. If you're sharing your screen, working together, fill it out. And then just the next one is, what city or cities do you live, work, or serve? So as you know, Tri-City is a mental health provider for Pomona, Laverne, and Claremont, and we also encourage folks in our surrounding cities and communities to join us as well, as we like to share this information. So just going to give another second. I think we're pretty much good on our end, but thank you for those who are completing. A lot of you, it's just me, so thank you again for coming, and we have half of you from Pomona, and then the other half from another city in California. So thank you for joining us. As like I said, Tri-City is the mental health authority. We provide mental health services in Pomona, Laverne, and Claremont. So I'm going to just share those results real quick with you. All right, so we're going to move on. So this is just an overview, a few things that we look to cover for today's 1-hour presentation. We're going to talk about purpose, considerations for trauma-informed response, the rationale behind it, why we are talking about workplace from a trauma-informed approach, considerations that you might want to keep in mind for yourself or for your employer, or if you're an employer, for your employees, and then always like to end our webinar with some helpful resources that can be beneficial to you. So our purpose, and so just to give some background, this presentation was created because we had a lot of community members, organizations who were reaching out to us soon after restrictions were in place due to COVID-19. Businesses were closing or staying open or having folks work remotely. And a lot of folks were just trying to wrap their head around, how can I support my colleagues? How can I support my staff? How can I bring awareness of what COVID-19, the impact it's having on us just from a work perspective? Now we know COVID-19 has impacted every facet of our life, from where we shop to where we eat to just being out in open doors altogether. And obviously the workplace is one of those areas that's highly impacted. And so when putting together this presentation, I saw a really great article through SAMHSA, and they use their trauma-informed considerations for work settings to navigate how to respond to COVID-19. And the considerations that they used could be done in a workplace for sure, but could also be used for schools, clinics, places of worship, or services that folks may have maybe challenged or struggling with how to do due to COVID-19. And I'm going to talk about why we're using a trauma-informed approach when we're looking at these areas for consideration. So what does trauma-informed mean? And some of you may have a good idea about that. Some of you may not be too familiar, but we will talk about it today. And for this presentation, you can see it from multiple lenses: as an employee, as an employer, or if you're a volunteer, if you're an educator, if you do a lot of volunteer work, just trying to get back into some type of normalcy, some things you might want to consider before you take that next step. So we talk about a trauma-informed approach for trauma, and first and foremost, individual trauma results from an event, series of events, or set of circumstances experienced by individual as physically or emotionally harmful or life-threatening. And I will say, by no doubt, that COVID-19 has been very stressful. And for a lot of people, it is very impactful and can be or has been traumatic. And anytime that we are impacted by some severe form of trauma or stress, it impacts us in all facets of our life: emotionally, physically, mentally, our physical well-being, and our spiritual well-being. And so when we have something as impactful like COVID-19 that we are in currently, we have to approach it from all aspects of our life, not just one area. And as an employer or employee or someone who works with others or even just lives with others, just have a good understanding that how people respond looks differently, how they react is differently, and for sure the impact it has on their everyday well-being is very impactful, and it looks different for everyone. So hopefully we can take a step back and address what that looks like, one, for you, but then two, how to support yourself and others during this very difficult time. So what does trauma-informed mean? So it's an approach based on knowledge of the impact of trauma, aimed to ensuring environments and services are welcoming and engaging for services, recipients, and staff. Acknowledging the key principles approach of safety, trustworthiness, transparency, culture sensitivity, collaboration, and empowerment among staff. So that's what our goal is today, is using the trauma-informed model and applying how we respond in a workplace environment. And for those of you who just joined us, I see we have a few more folks. We will be talking about the workplace, how to support ourselves and colleagues from the lens of a trauma-informed approach, because what we are currently going through is very stressful and traumatic. And I don't know about anyone else, but this is the very first time I've been a part of a pandemic. And so this is new for me as well, as it is for so many people. At any time, if you do have a question, please use your Q&A box to type in your question. As we go through the presentation, we will be addressing those throughout, and for sure by the end, hopefully we cover all your questions. And just before I move forward, do we have any questions from our participants?
No questions.
Okay, thank you. So SAMHSA looks at 3 areas that they've talked about when we talk about a trauma-informed approach and how this applies specifically in the workplace. So we're looking at how to create a safe environment. How do we do that during a pandemic? Do we feel safe? And how do we create a space where folks, not just employees, but those who we serve, who come to our place of business, who come to our place for services, do they feel safe in our environment? How to build relationships and still feel connected when we may be socially disconnected, physically disconnected. I know for us, a large amount of Tri-City staff are working from home. So how do we feel connected to colleagues who we haven't seen in a few months? And how do we stay connected, and how do we support each other during this very difficult time? And how do we build those relationships even stronger while we're being distant? So these are the 3 areas that SAMHSA talks about and that we will be addressing throughout this presentation. And if you have any ideas, and if you have things that you have done that works really well in your place of business or service, please put those in the Q&A box and share those with us, as well, as we are always looking for great ideas and collaboration. So the rationale for this presentation, I feel I've kind of covered it, but just again, COVID-19 is bringing a lot of uncertainty and an increased amount of stress, and it comes in waves. Sometimes when we think we got it under control, something else happens, and then it brings up another layer of stress that we were anticipating. When we're under acute stress, we are likely to operate from a survival response area of our brain. And the survival response is that fight, flight, or freeze response, where we're highly activated to respond in a survival way as opposed to a thriving way. And so when we are constantly having our survival response activated, we are not able to rationale like we would without the stressor in place. We may not think rationally, behave rationally, and also respond in a way that's rational. So just being aware and acknowledge that you yourself or colleagues that you're working with, you may see a difference in them, you may be concerned about them, and the concern may be is because they're highly activated in the survival responsive area of the brain, where they may need support on how to calm down and regulate that, because the key is to find how to regulate our emotions, which we are less likely to do when we are stressed out. And with these considerations, we hope to have tools and support to get through this. And I think everyone's looking for a way, for a tool, for that magic something that really gets us through. And for everyone, it's going to be something different. At this time, I'm going to take a second polling question. If you please can just feel free to respond to this question. This is another two-part question that I'm going to launch. And the first one is, with safer at home guidelines, what adjustments have you had to make to your work routine? And what has the impact those adjustments have made? Like I said, some of us may have had no impact. I still got to show up and go to work. My job is essential. What I'm asked to do is needed. So I still have to. But just because you're still showing up at work doesn't mean that you're not stressed or having some type of impact on your well-being. Some of you may be working off-site from now on. Some of you may have been furloughed. So please just let us know how these changes have made an impact on you. And just acknowledge that even though we're working from home, it still can be stressful. So I think we're good right here. I'm going to just leave it on for another second if you haven't completed it. All right, so I'm going to end it. I'm just going to share the results with everyone so everyone can see. Now have to work off-site or at home, which is very normal for a lot of folks. For me as well, I'm actually doing this webinar from home. So I should give a disclaimer. If you hear a dog bark, that's me at home with my dog. And then the impact. So some people said little impact, and then there's a few that said very impactful. And I definitely would agree. I definitely would agree that there has been some huge impact for us, and still trying to address how to make adjustments. You know, I've been working from home for a few months, and just when I think I got a routine down, there's days where I'm still trying to juggle it all and feel like I have to make some adjustments along the way. And I would say for folks who are in that same boat, just acknowledge that. Like, today was a good day. Tomorrow we'll take it on and handle what we can do. So thank you for sharing your responses and being honest with what you currently are experiencing due to COVID-19. All right, so things to consider. So again, all these considerations are from a workplace environment, but again, can be used in any environment that you are having to make adjustments for due to COVID-19. But because workplace is so heavily impacted, this is the area that we are focusing on. But I believe and have confidence that the tools that we're going to talk about could apply to various environments as well. So we're going to look at these 5 areas first that SAMHSA kind of highlighted that we should be mindful of. Supporting regulation, prioritizing relationships, explain the why, expectations, and healthy behaviors. And so for some of us, some of these changes may be very minimal, and for others, these changes may be very impactful. And for a lot of us, I'm still trying to figure it out, and we're still trying to navigate these uncharted waters as we go through these next weeks and months with this pandemic we're in. For support regulation, so just be mindful, when stressed, people have a harder time managing their emotions and staying regulated. You know, you may have a shorter temper, you may be more agitated, you may find that you get frustrated very easily. Even with technology, simple little frustrations like, why can't I connect to the internet? Why is my internet crashing? Why can't I access my emails? We can have a very difficult time managing our emotions, and the littlest things that didn't bother us seem to really agitate us. So just acknowledge that that is common, and what you can do, whether you're in the office or working from home, and if you're in a leadership role, be mindful that your staff are struggling with that. And one of the best things you can do, and why you may be in a leadership role, is because you're able to model a behavior or a response where your employees can feel safe to disclose what they're going through. So either model the behavior or even just talk about it in a safe way, and just realizing staff may need more support than usual, and that's okay. And what does that look like for them and for you? Prioritizing relationships. I've always said my work family is like my second family. I spend probably just as much, if not more time with them than I do my actual family. And being disconnected from them, not being physically in their presence, can take its toll on folks. So just, again, social support and connection can actually buffer a stress response. So if you are still working at the same job site, how do we do that in a safe way to stay connected with being physically distant? For a lot of us who are currently working at home, how can we stay connected? Do we check in more frequently? Do we check in with each other, whether it be over the phone, through an email, or even if you have the ability to do virtual meetings online, which have been a really great resource for me to check in with my team and colleagues at least once a week, if not monthly, to do some visual checking in. We also know that there's a lot of changes that are being made. So explain the why. And some of these changes may be fluid, constantly changing, and then some might be more consistent. But just taking a moment to understand why something is happening, like a new policy, a new practice, explaining that to your staff, explaining that to your colleagues, can kind of ease them into the changes, gives them a better understanding as to why, and can decrease their stress. And so anything that we can do to decrease a very stressful situation is always going to be beneficial to your colleague or your staff who may be very stressed out. So just explaining things, and even if these are things that to you may not be that major, can be very major for other folks. So again, just taking a moment to explain it, and then asking questions. Do you understand? Do you understand the changes? Does this make sense? Can be very reassuring as well. As things change, what are the expectations now? In uncertain times, having an amount of uncertainty or being certain about a lot of things can be very helpful. Sharing information can be helpful. So what are the new priorities? How does this impact my job, my daily routine, my responsibilities? And again, having a dialogue and communication about those expectations can be very helpful. And then last, just healthy behaviors. Acknowledging that even though we still have a job to do, that it could be very stressful and impactful, and it may be difficult to do what we're used to doing. So maybe the job hasn't changed so much, but the amount of stress we're under for personal reasons, due to personal concerns we have due to COVID-19, can be making an impact on our job. And vice versa, because of demands and expectations and changes to our daily job, having to learn a new routine can be very stressful and can have an impact on our personal lives as well. So they do go hand in hand, and just being mindful of that and acknowledging the impact on, like I said from the very beginning, all aspects of our life are being impacted. And then what are healthy behaviors? And then, part of the check-ins is, what are you doing for self-care? What are you doing for taking care of yourself? And having those conversations can be very helpful. So principles of trauma-informed care. So the next 2 slides are 6 categories that are outlined in the toolbox for trauma-informed care. And these are more specifically talked about with regards to work environment. So physical safety, I would say this is probably one of the number one concerns that people have, the physical safety, because we have to be physically distant for our safety. So it's important to address the safety concerns related to physical space. A safe environment decreases the stress response. Physical safety is a priority, especially for this health crisis that we're in. So if you are working at your job site or anticipate returning to your job site, do you physically feel safe to be there? Do you have the safety equipment you need to do your job? Is there things in place to allot for 6 feet of distancing? Having, access to things that are a challenge to have access to, such as gloves, hand sanitizer, masks, all those things. So just be mindful of that. And even If you're working from home, do you feel physically safe to be at home to work and do what you need to do? If not, how are those concerns being addressed? Emotional safety, again, acknowledging that our well-being is being impacted during this pandemic. So pay attention to nonverbal cues. Ask questions, ask your colleague, ask a coworker, ask your boss, how are you doing? How are you staying well? And just having some type of normal communication. And I will say that this pandemic really strips down barriers as far as our roles and responsibilities, and we're just all human. At the end of the day, we're all still human, and just checking in from a human level, like, how are you doing? How are you coping? And how has this made an impact on you? And just having safe, supportive conversations is really great, which goes into our peer support. Hopefully you have colleagues and friends that you can count on. The peer support can help suppress a stressful response. So hopefully you have a way to stay socially connected during a being physically distant, using technology such as social media, texting, FaceTime, Zoom. Zooms don't have to be just for meetings. Zoom can also be just to check in to say, how's it going? How are you doing? What was your day like today? I know I've used Zoom for personally to check in and stay connected with my family because we can't see each other as frequently as we would like. So Zoom has been a great support system for us. Before I go on to the next slide, I just want to check in if we have any questions.
No questions.
Okay, perfect. Again, please use the Q&A if you do have any questions about it. Anything we've covered so far. All right, so the last thing is trust, choices, and culture. So these, again, kind of mirror what we've already talked about, but I really want to highlight that being transparent fosters trust and creates a sense of value for staff. And for me and my staff, I try to be as transparent and have an open communication with them, what they need to know, what I think would be helpful for them to know, maybe alleviate some of the stress they may be under, try to be as transparent. Granted, there are some things that they may not need to know, but anything that is on the table and can be shared should be shared. Communicate regularly, any updates. I'm sure a lot of agencies at this time have had to make a lot of updates to their policies, practices, and procedures on how they do day-to-day activities, even if we are working remotely. So just share what those are, how that impacts them, and just be mindful that some of these changes may be difficult, may be challenging, and then obviously always creating a safe space for them to feel that they can ask questions and express some concerns to build trust moving forward. Giving staff and your colleagues opportunity to make some choices. There are some things, again, that they might not have a choice. It has to be because we are following state, county, and local guidelines that are out of our control. But if there are some situations and some choices that have to be made, maybe you want to ask your staff or ask your colleagues what their thoughts are, or do they have an idea of what could be helpful to address these concerns that are coming up. This can be very empowering. It gives staff a sense of purpose, a sense of belonging. It creates them an opportunity to feel heard, that you are taking their advice or their opinions into consideration. So solicit information from the staff can be empowering. Looking at, listening to their options, listen to their choices, and this can be very beneficial. This might take some pressure off you to not have to come up with all the answers on your own, but just really hear that. And the last thing just to keep in mind is culture. Anytime we talk about trauma, traumatic stress, culture does play a huge role into that. How we respond can also determine our culture, our background. If we have identified challenges in our personal lives from a systemic challenge, Some of these changes may be difficult to understand. There may be some lack of trust or mistrust. And so this crisis will affect groups of individuals differently based on multiple factors such as history, access to service, and racism. Think about how underserved communities will be impacted by policy decisions made during this time. So what might be a minor change or a change that from your perspective may not be a big deal could be a huge deal from someone from a different background than you, just because of a lack of trust that they may have from a systemic point of view. So just be mindful of that. I'm going to do my last polling questions, and hopefully we can get your feedback. So the question I have are, what concerns do you have about going to or returning to work? So a lot of you said you're currently working from home, but at some point we may be going back to work. So what concerns do you have? Because we'll be talking about these next on our next slide. And this is, I believe, a multiple choice, so you can pick more than one answer if you feel there's quite a few of these that could be available or on your concern. Okay, so I'm going to end it right there. Thank you for everyone for providing your feedback, and I'm going to launch the results. So it looks like a lot of us are the new norms, and I cannot agree more with you at this point. So many times in conversations, I want to say, when we go back to, but the reality is what we go back to may look very different than how we left it. And so just acknowledging that the uncertainty of new norms can be very challenging and stressful for us who are creatures of habit and don't like change, and change takes a long time to adjust to. We may not have the time or the ability to go through it at a pace that we feel comfortable with. Second one is safety. Absolutely. You know, how do we feel safe going back to an environment where there's still COVID-19? We unfortunately do not have a vaccine for it. So how do we go about our day knowing that the safety concern for our health? And then expectations. Absolutely. How do we do our we have a job to do, but what are the expectations? What are the priorities? What are the new priorities? And how do I incorporate those into my daily routines? And absolutely job security. We've been going through this since March. We are about 3 months in, and there are still folks who have a good fear about job security, even if they are currently employed. What does that look like in the future as we continue with this pandemic? So thank you very much for sharing and giving your feedback. What I'm going to do is employee concerns. So what research has showed up to this point are some concerns employees have, and that is, again, job security. Is my job, my position in jeopardy of being eliminated? Can I potentially be laid off? Or if I have been furloughed, am I able to come back to my job? And when I come back, what does that look like? Again, expectations. Are there changes to my job? What new responsibilities do I have? So again, I feel communication with staff and managers and supervisors, outlining what those are, and even just saying, like, right now we're not 100% sure, but this is what we do know, and this is how we feel we can best move forward. Safety. What's in place to ensure the safety of my health when I return to work? Just because restrictions are being lifted, there are still folks who don't feel quite safe to go out into public, who don't feel safe to go out to do their normal things. And safety in the workplace is a concern, but again, this pandemic has gone and interwoven itself in every aspect of our life. So just as we're looking at these concerns for work, these are still concerns that go to our personal life. Do I go to a college or high school graduation celebration? Do I go to a birthday party? Do I put myself out there and engage in what normally would have been a sure thing, no problem, I'm there, to do I go, do I don't go? If I don't go, am I hurting their feelings? I don't want to hurt their feelings, but my safety is also priority, especially if you do have an underlying health issue that you're mindful of. So there's a lot of things to take into consideration moving forward. So the last thing is new norms. What are the new day-to-day operations? What are the new things that we should be taking into consideration that I need to be aware of? Again, they may be changing. What may be in place today may look different next month or in the next 3 months. And so just, again, having that line of communication as things adjust and we have to make accommodations and revisit certain policies and procedures, being flexible with that. And then resources. What resources do I have access to if I need assistance? And not just a job, but for other areas of our life regarding health benefits, insurance, finances. So what can my employer help me with, or what other county, states, resources do I have access to? And then the last is office morale. For some people, going back to the office would be great to see each other and might be thriving. And then for some folks, it could be very stressful and very daunting. And how can we navigate that? So how will leadership ensure positive office morale during this transition? Again, these are just things to take in consideration. These are just topics to discuss. You may have already had these conversations, and maybe these are things you have been thinking about. Hopefully, from a perspective of being trauma-informed and acknowledging that though I have a job to do, a task to take care of, a responsibility, how I do it from a stressful response may not be healthy. So how do I take care of myself? How do I acknowledge that the amount of stress that I'm under due to COVID-19 impacts my work, my home, my relationships, my daily activities, and just being mindful of that, and how can I take care of myself in hopes that I can minimize some of this impact and stress that I'm going through. So one last thing to take into consideration is collaboration. And if you haven't done this already, maybe that's something you want to do, whether at your job site or with other areas in your life that you work in a large group. How do we collaborate? How do we build on each other's strengths? So looking at interagency departments, other agencies, organizations that you've worked with in the past, or maybe you haven't worked with in the past, but now you really want to reach out and extend a way to connect with them. And how do we do this while we still have to have some restrictions and guidelines in place? Given the needs and demands of the crisis it brings, how do we collaborate and do that? So just a few tips. Collaborating with other systems to ensure policy and practice decisions do not create barriers to services. So how do we still provide services with minimal barriers? And some of these barriers may have to be in place for our safety. So acknowledging that there's just some things we're not going to be able to get around, but also what can we do moving forward to minimize some of those barriers? How do we come together to promote a shared understanding and deliver these services? If you need to up one aspect of your service, but you don't have the manpower, maybe you want to find an agency or organization to collaborate with to work together to provide a service that maybe at this time you're not able to until you can get it up and running within your own agency. New partnerships and non-traditional collaborations can build healthy, productive relationships. So again, Tri-City Works, Pomona, Laverne, and Claremont, we have a lot of great partners that we've built over the years. So reaching out to them, saying, I'm here for you, this is what we can do, and this service that you provide, how can we get our participants to to utilize those if possible, and vice versa. Any participants that you have that are looking for support, how can we support them? And then look outside the box. Maybe agency organizations that you haven't worked with before or haven't identified, but maybe now's a good time to extend an olive branch and say, hey, this is what we do, and this is support that we can offer. How can we work together to serve a greater community who needs a lot of support at this time? Because there are a lot of individuals who do need support, just haven't found a way to access it, maybe are not quite ready to receive it, but definitely need support in areas that they've never probably had to access before. And so just acknowledging that and saying, whenever you're ready, we're here. And then just new partnerships and relationships kind of ensure a greater effect and efficiency. So just trying to be mindful of, time, energy, effort. One person can't do it all, acknowledging that and saying, this is what we could do, and this is how we want to collaborate with others moving forward. Before, I'm just going to pause because I'm almost done and we have about 10 more minutes before we wrap up. Is there any questions at this time that we should be answering?
No questions.
Thank you. So this is just again for resources and reference. This is where some of the information we pulled. COVID-19.ca.gov is a great resource. There's a lot of great information there for folks who are wanting to be up on at a state level. What are we doing? What services do we have access to? What resources are available from financial assistance, medical, insurance benefits. I know for those who were trying to access their stimulus checks. So this is a great resource. If you haven't visited, I highly encourage you to do that. They're always updating their information from a state level. As well as ACEs Aware talks a lot about trauma-informed. If you want to know more about stress and trauma-informed care more in detail, that's another great resource, as well as SAMHSA, who came up with the trauma-informed response overview. They have a great handbook that covers that. And then also to just locally, just be mindful that Tri-City Mental Health is here to help. Tri-City, fortunately, has been able to stay open and provide services since day one. Even with all the physical distancing, safer at home restrictions and guidelines, Tri-City has been able to keep its doors open to provide services, support, resources to our community partners and our residents for sure in our service area. So if you need support, our community navigators, this is the 888 as a toll-free number. There is a navigator who is on call over the weekends and after hours. So if you need resources, referrals regarding food, medical, legal, mental health, physical health, so much information, food banks, assistance in for education for your kids, for schooling, please connect with the navigators. Someone will be available to assist you with information. We have our well-being support chats for non-emergency. You can call Monday through Friday and connect with Chris Anzalone, who's actually on this webinar, to see what type of supportive services someone that you know, or maybe for yourself, who can benefit from talking to someone that's not in crisis and who's not a current client of Tri-City. And then last, we have our crisis support services, which is 24/7. This is the number you can call to speak to someone for our supplemental crisis after hours or during office hours. There is someone who can call, you can speak to if there is a crisis. So at this time, just want to say thank you for joining me today. I hope you found this information helpful and beneficial. If there is anything that you have incorporated that has been a great benefit to you or your colleagues, please share that in the Q&A. This, again, is being recorded, so if you would like to share this with other colleagues, we will definitely encourage you to go to our website, which is down here at the bottom, so they can view the webinars and also be aware of upcoming webinars we will be doing. Just so you know, Tri-City offers webinars every Tuesday from 11 to 12 in English, and then we offer the same one in Spanish on Thursdays from 11 to 12. And then on Thursday afternoons, we have our community connections, where we have a great dialogue conversation on topics that people can benefit from mindfulness, meditation, self-care, well-being, and then any topic that we feel the community is can benefit from, we'd like to provide. So again, if you can, just take a moment when we wrap up and leave this webinar to complete the survey that you should see on your screen. I thank you in advance for attending, for participating, listening to me. Hopefully there was some great information, and share it. And I hope to see you back next Tuesday. We'll be talking about everyday mental health, how everyday mental health challenges, and then obviously with COVID-19, how that impacts us in our everyday lives. So thank you again. I appreciate, and I'll just stay on for another second in case there's a question that comes up. But enjoy the rest of your day, and looking forward to seeing you back on next week. Daisy or Chris, was there any last minute questions?
No questions.
Okay, perfect. Thank you so much. I appreciate your time.